So if you're a clinician that works with ADHD and autism, it's important to pay attention to the comorbidities and know the comorbidities, especially the comorbidities that can actually trigger misdiagnosis. Something like dyspraxia. Dyspraxia is a disorder in which the individual has a lot of basically excessive clumsiness and in some cases difficulties with speech and a little bit of cognition and planning. But mostly it is a disorder of fine motor skills and gross motor skills. Essentially, mega clumsiness. But it is a standalone. It can be by itself. You can have dyspraxia without having ADHD or autism. But if you have ADHD, there's a 50% chance that you also have dyspraxia as well. There is also links to comorbidities with dyspraxia and autism as well. But I wasn't able to find numbers on that. But there is a comorbidity. It's there. But of course, if you're looking at a young child who is experiencing, what seems like recklessness, carelessness, just kind of falling into things and running around. You're like, what are you doing? Oh my God, stop falling into things, stop running around. They're like, Mom, I can't figure it out. I don't know what's going on. Sounds like an excuse. Sounds like ADHD. And then that same kid is going to have issues with fine motor skills. And we know that dysgraphia and careless writing are often comorbidities with ADHD. So when we're looking for things like this, we also have to consider the possibility of dyspraxia, not just as a comorbidity, but sometimes as a standalone when we're looking at a kiddo. We have to look at what else they're experiencing. And one of the easiest ways to assess for dyspraxia is to consult mom or dad about developmental things. So when you have dyspraxia, there will be developmental delays. Blah, 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 blah. Wow, words are hard this morning. Developmental delays, especially in the area of crawling and walking. They'll be later to do that. Sometimes they'll also be later to talking in full sentences. And yes, dyspraxia is treatable, but it's not treatable with medication. It is treatable with OT, PT, and speech therapies. So there. Now that's something you know. And knowing stuff is cool. And so are you.